everyone. We are going to add another level of protection against the COVID-19 virus, and that is actually through rapid testing. We've taken possession of a large quantity of the Abbott rapid antigen test. So just like previous videos, I'm going to walk through some of the logistics of how we're going to deploy this and use this. And then Dr. Jarvis is going to come back and talk about some of the science of this particular test. So first, we'll do some routine testing. We are going to test all asymptomatic employees on the first day of your work week. So that is either Monday, Tuesday, or Wednesday. We'd like for you to do that right at shift change. And when you perform the test, it'll either give you a negative or a positive. If it's negative, you just continue working. If it is positive, then we want you to isolate, and then we'll schedule a confirmatory PCR test. If the PCR test is positive, you'll continue to isolate. If it's negative, you'll return to work as long as you're asymptomatic. Dr. Jarvis will cover some of the science on the reason behind that. Let's talk about post-exposure. So we're just going to surveil everybody and do surveillance testing. That's once a week. Then we'll have post-exposure testing. The post-exposure goes into two different routes, vaccinated versus unvaccinated employee. So for vaccinated employees, a vaccinated employee is considered someone who has received both doses of the vaccine and you are 2 weeks past that. Once then, you're considered vaccinated. Now, how are we going to know that? A little side note, you're going to get a survey here in the next week or so asking your name, which vaccine you received, which for most of us, or most of you, will be the Moderna vaccine, and what days did you receive the vaccine. I need that back so that we can make this determination. So please make sure you fill out that survey. So what will occur is, if you have an exposure and you are considered vaccinated, you will continue to work no matter what phase we are in, phase 0, 1, or 2. What we will do is we will have you perform one of the rapid antigen tests every day whenever you start your shift. Not every day, not your days off, but the day that you come on shift, we will have you perform the rapid antigen test and then report that. If it's negative, you continue to work. If it's positive, we'll schedule a confirmatory PCR. If that's positive, you isolate. If that's a negative, you can return as long as you are asymptomatic. That's for vaccinated folks on a post-exposure. For unvaccinated personnel, then we will follow basically the same, or we will follow the same thing in phase 0 and phase 1 staffing. There will be a change in phase 2 staffing. In phase 2 staffing, if you're unvaccinated, we will have you perform the rapid antigen test every day when you come on shift for 7 days past your exposure. If it remains negative, we move on down the road as long as you're asymptomatic. If it's positive, guess what? We do a confirmatory PCR and go from there then. If you have a household contact, let's say you're a vaccinated employee and you have a household contact who is positive, we'll follow the same process. You'll still come to work. We'll do the rapid antigen test for the next 17 days because we have to go 10 days from when that person is positive and then 7 days for you, so that's 17 days. You'll perform the rapid antigen test for 17 days then. If you're unvaccinated and you have a household contact that is positive, we'll follow the same processes that we do now. It's either phase 0 or phase 1, and then we'll follow the testing process or the regime that we have set out for that. So there's vaccinated and unvaccinated, and it depends on what we do then. What about employees that have had the active disease within the past 90 days? Well, the CDC currently recommends if you've had COVID and you've recovered from the day that you develop symptoms or tested positive, 90 days forward, if you have an exposure to COVID, there's no need to quarantine or test you, and we'll follow the CDC recommendations. If you're past those 90 days and have not been vaccinated, we'll treat you just like an unvaccinated employee. And if you have been vaccinated, then you'll be treated like a vaccinated employee. Again, that's the CDC's recommendations. Those are always subject to change, and if they do change their recommendations, we'll change to adapt to that. Let's talk about what if you're on duty and you become symptomatic. If you are on duty and develop symptoms, you can go ahead and perform one of these tests while you're on duty. Okay? If you're negative, we're still going to send you home. If you're positive, we consider that a positive. Most likely, either way, we're going to get a confirmatory PCR test because you are symptomatic and showing symptoms, and we want to make sure that we confirm that with a PCR test. What if you become symptomatic while you're off duty? Do not come to the station to take one of these tests. We will schedule a PCR test just like we currently do, and then go from there on that. So let's talk about the testing process, what we are asking you to do and what I will do every Monday also. Each station will receive a box. Let's go over the contents of this box. But I'll tell you, you're going to get one of these boxes at the station, and when the contents run low, when the number of tests get low, just order another box. So let's go over the contents of the box. Inside of each one of these boxes comes a little procedure card. You're going to want to hold on to this because it tells you exactly how to perform the test. It also shows you what positive, negatives, and invalid tests look like. So make sure that you hold on to this. It comes with a little fact sheet for healthcare providers. That's just part of a test. They have to provide this. It comes with a little information card if you want to read all this very small print. Even with my glasses on, I still can't read that. And it also comes with 40 patient fact sheets because there's 40 tests in each one of these. Now, when a box is delivered to you, there's only going to be 38 tests in here, and I'll talk about why. When we receive a box in, it has 40 tests. You can see all of the little tests individually packaged. It comes with a reagent. This box has one bottle of reagent for all of these tests. It is very important that you maintain this and don't lose this, because if you lose this, the box of tests are no good. So make sure that you keep an eye on that and remember where it is. It comes with 40 nasal swabs. We'll talk about those here in just a second. You have to use the nasal swabs that are included in this kit. You can't use any other nasal swab. You have to use these. The kit also comes with a control. So part of what we will do before we deploy the box out is we'll run a positive control and a negative control. So that's the reason that you will only have 38 tests, because we will use 2 of the tests that are inside of the box. One on the positive control, one on the negative control. I'm not going to walk through how to do the controls because we'll do that before we even deploy them out. A couple of key things. One is reporting. When you do this test, we have to report every test, positive or negative or even inconclusive, that is done. So you're going to have a form, an online form that you'll fill out that'll ask a series of demographic questions and different things, and then also about the test and the results of that. You must fill out that form every time you do the test. The form takes about 2 minutes to fill out. Obviously, if the test comes back positive, you need to make sure that you notify the commander immediately, and then we'll start the process that goes along with that. So let's actually walk through a test, and you're going to see me give myself a test here. One of the questions that the form is going to ask is for the lot number. That is not the lot number for the box. That is the lot number for the test, and you can find that right here. It says lot, and then it has a series of numbers followed by a letter. That's the number that you want to put in. The kit comes like this. When you open it, you'll pull out the test. This is what the test looks like. Okay. Couple of key things. One, you want to make sure that this blue line is present. That is the control for all of these tests. If this blue line is not present, do not use this test. Discard it and go to the next one, but do not use this test if that blue line is not present. You will also see the blue line on the inside. So you need to see the blue line on the outside and the inside. Okay? Important, put your name on the test, because if you have a couple of these laying around, you don't want to get them confused. So just write your name on the test here. For this, what you're going to do is open it up, pull it out of the package. I suggest kind of bend it back because that helps it keep flat. It's a lateral flow test, so it must remain flat whenever the test is going. If you have the test bent or you're carrying it around, then the flow does not occur correctly. So make sure that you keep the test flat whenever you're performing it. Okay. A couple of different things here. So I've got the blue line. You'll see one well right here, the top well, and then the bottom well. When we talk about putting the reagent, 6 drops of the reagent into the top well, we're talking about this top hole right here. When we talk about putting the Q-tip or the nasal swab into it, we're talking about this bottom one. And it walks you through. So the first thing you're going to do, open it, kind of bend it back a little bit. You're going to put 6 drops of the reagent, exactly 6 drops, into this. When you put the 6 drops in, you don't want to do it like this. You want to hold it above it about 1/2 inch and drop 6 drops in there. From the time that you put the 6 drops in until the nasal swab goes in there, you have 3 minutes to do that. So there's plenty of time to put the drops in here, do the swab, and then put it inside of here. Once you put the swab in there, you'll spin it 3 times to the right. And then you'll peel this off, close it up, and you wait 15 minutes. You have to wait 15 minutes to read the results. If this line right here, the control line, turns pink, and the sample line, there's nothing there, that's a negative. If the control line turns pink and the sample line turns pink, that's a positive. If this control line does not change colors and it stays blue, that's an invalid test, and you'll have to redo it. So we're actually going to walk through a test. I'm going to test myself here, so we're going to walk through that. Okay, so I have the test open. I'm going to take the lid off of the reagent and put in 6 drops. 1, 2, 3, 4, 5, 6. Again, I have 3 minutes now to put the swab in there. Utilizing the swab that is provided, little tip here, do about 5 huffs into your mask, not blowing your nose, but kind of holding here, and the reason you're doing that is to build up a little bit of moisture in your nose. So I'll demonstrate. Pull down your mask, open the swab, 5 seconds in one nair, 1, 2, 3, 4, 5, only about a ½ inch in, to the other nair, 1, 2, 3, 4, 5. Take the swab, insert into the bottom hole until it goes all the way to the top. Rotate it 3 times. 1, 2, 3. Peel off the little sticky. Stick it. And then set your timer for 15 minutes. Okay, it's been 15 minutes, and this is my test here. As you can see, it is negative. So the top line is pink. It turned from blue to pink. The bottom line is not present, so that means that's a negative test. This is a control, the positive control, and you can see what a positive test would look like. The top line is pink, the bottom line is also pink, so that's what a positive test would look like. When you're done with this test, throw this into a sharps container, and then you are done with the test. A couple of key things to go back over. 1, we have to report all tests, negative, positive, inconclusive. Please make sure that you go online onto that form, fill out all the questions, and then submit that form. Remember, this is a lateral flow test, so the test has to remain flat. You can't carry it around, hold it up, push it down. It needs to remain flat for those 15 minutes. Remember to check for the control. Check for the blue line before you start the test. If there's not a blue line, do not use that card. Also, the blue line must turn pink whenever you run the test. You need to wait 15 minutes whenever you run the test, not before. You can go up to 30 minutes. After 30 minutes, you need to discard the test and use another one. So you can read the test between 15 and 30 minutes. 15 is the optimal time. Remember to put 6 drops of the reagent into that top well, only 6 drops. And then invalid test, when you look at the results, when you look at these 2 lines right here, if you don't see any lines, that's an invalid test. If only the sample line is seen and not the control line, that's an invalid test. If the blue control line stays blue, that's an invalid test. Okay, so you got to look for those things. On the swab, only use the swabs that are provided. Put it into your nair about a ½ inch, rotate it 5 seconds, pull it out, place it into the other nair, rotate it 5 seconds. And then when you put it into the card, remember, rotate 3 times, peel off the sticky, and then let it sit for 15 minutes. That's all covered on that procedure card, just in case you forget. If you have any questions about these tests, please let me know. Again, Dr. Jarvis is covering some of the science stuff. You guys stay safe. Rolling, 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 rolling.